So lymphadenopathy can be localized and can be generalized. Localized means single group of lymph node is enlarged, that is localized. And generalized, that is the definition of generalized lymphadenopathy. It is defined as enlargement of more than two non-contagious group of lymph nodes. More than two non-contagious group of lymph nodes. Then it is called generalized lymphadenopathy. So lymphadenopathy is a common and non-specific site. Common causes include infections from minor one like common cold, abscess, cellulitis, etc. to serious one like HIV, autoimmune diseases, cancers. So the causes for enlarged lymph node, that is lymphadenopathy, range from mild to serious. Mild like common bacterial infections, abscess, cellulitis, etc. to serious one like HIV, autoimmune diseases and cancer. So lymphadenopathy or adenopathy, it is a disease of lymph node. That means it is the enlargement of lymph node. So lymphadenopathy, it is inflammatory. That is called lymphadenitis also. So producing swollen enlarged lymph nodes. So we can call it as a lymphadenitis also or lymphadenopathy. That is the distinction between lymphadenopathy and lymphadenitis is rarely made and the words are used in exchange for one another. So the lymph nodes which you can palpate are mainly the lymph nodes in cervical region, lymph nodes from axilla, and lymph node in the internal region. These are the superficial group of lymph nodes which you can palpate or which you can examine. The deep lymph nodes like thoracic, abdominal, we cannot palpate. That lymph nodes we cannot palpate. So which group of lymph nodes we can palpate on general examination or we can check on general examination? Mainly the lymph nodes in cervical region, lymph nodes in axilla and lymph node in internal region. But for us important is lymph nodes from cervical region. So there are various group of lymph nodes from cervical region, that is from neck area. So from behind, start from behind, the first group comes occipital group, that is at the base of skull. Then come post auricular behind the ear, pre-auricular in front of ear, parotid group of lymph nodes over the parotid gland. Then this is deep group of lymph node, that is also called tonsillar group, that is digastric. It is a part of the cervical group of lymph node. Then come submandibular, submental below the chin. Then in cervical group, superficial cervical group of lymph node and deep cervical group of lymph node. Superficial cervical group of lymph node lies overlying the sternocleidomastoid muscle, and deep group of cervical lymph node lies behind or posterior to the sternocleidomastoid muscle. So deep group of cervical lymph node mainly include jugulo-digastric, jugulo-omohyoid. These are the two important group of lymph nodes. And then comes supraclavicular. So superficial, the lymph from superficial group of lymph node ultimately drain into deep group of cervical lymph node. And this is supraclavicular group of lymph node above the clavicle. So these are the important group of lymph nodes from the cervical region: occipital, post-auricular, pre-auricular, parotid, jugulo-digastric, submandibular, submental, superficial cervical, deep cervical, and supraclavicular.
Which guy? 43 आहेत.
बघा आता 5 मिनिटं वाट बघा तुम्हाला जॉईन व्हायला वेळ लागला थोडं 5 मिनिटं
हॉस्पिटलकडे यायचं होतं.
पुन्हा absent पडली नाही.
नाही आज डबल जर मॅडम तुम्ही लिखायचे असते समजेल ना असं म्हटलं तर मोरवर यायचं येतं मोरवर मोर मोर मध्ये सेव्ह चॅट मॅडम हे
बरं ठीक.
इथं क्लिक केलं सेव्ह चॅटवर
हम्म.
इथं फाईलच्या पुढे 3 टिंब आहेत
हम्म.
त्याच्यावर सेव्ह मारायचं फक्त
बरं.
हम्म?
These are the important group of lymph nodes for cervical region. So lymph node is nothing but a part of immune system, a part of reticular endothelial system. So lymph node in conjunction with spleen, tonsil, adenoids, and Peyer's patches. These are highly organized centers of immune cells. These lymph nodes in conjunction with spleen, tonsil, adenoid, and Peyer's patches. These are highly organized centers of immune cells that filter antigen from extracellular fluid. So what is the function of lymph node? To remove foreign antigen. The function of lymph node is a part of immune system, it is a part of reticular endothelial system. Its function is to remove new, any foreign antigen from your blood. That is the function of lymph node. Lymph node with its high concentration of lymphocytes and antigen presenting cell is an ideal organ for receiving antigen that gain access to the skin, from GIT, from blood, etc. The nodes they have considerable capacity for growth and change. Lymph node size depend on the person's age, the location of the lymph node in the body, and the antecedent immunological event. In neonate, lymph nodes are very perceptible, but a progressive increase in total lymph node mass is observed until later childhood. Lymph node atrophy begins during adolescence and continues through later life. So, about lymph node, it is a part of immune system, it is a part of reticular endothelial system. Its main function, or it is a highly organized center for immune cells. Highly organized center for immune cells with its high concentration of lymphocytes and antigen presenting cells. So, its main function is to remove any unidentified or foreign antigen from your blood. That is the function of lymph node. So, lymphadenopathy means enlargement of lymph node. This enlargement of lymph node can be inflammatory, can be non-inflammatory. So, the important causes for enlarged lymph node or lymphadenopathy are mainly infectious causes. In infectious causes, acute infection, chronic infection. It can be bacterial, it can be viral. So among viruses, the important viruses which can cause enlarged lymph node like herpes, adenovirus, cytomegalovirus, HIV virus, and varicella virus. These are the viruses which can cause enlarged lymph node among viruses. Among bacterial, acute infections and chronic infections. In acute infections like abscess, cellulitis, etc., any acute bacterial infection can cause enlargement of lymph node in the nearby, in adjacent area. Adjacent area means the area of drainage or the group of lymph node for that area. Enlarged group of lymph node for that area. So acute bacterial infection and chronic bacterial infection. Chronic bacterial infection, the most common cause in our India is tuberculosis. Most common cause is tuberculosis, which can cause enlargement of lymph node in cervical region. So in chronic bacterial infection, the most common cause for enlargement of lymph node is tuberculosis. And plague, now it is not seen. Plague is eradicated now. So the most important chronic bacterial infection causing enlargement of lymph node is tuberculosis. So in infectious etiology, viral bacteria. Then another important cause for enlargement of lymph node is malignancies. Malignancies either primary or secondary. Primary malignancy of lymphatic system, or secondary means secondary to metastasis. Secondary to metastasis. So leukemia, lymphoma is a primary malignancies which can cause generalized lymphadenopathy. These are the malignancies of lymphatic system. So they can cause enlargement of lymph node means generalized lymphadenopathy. That is primary, and metastasis from primary cancer. So malignancy is very important cause of enlarged lymph node. Whenever there is enlarged lymph node in old age, our duty is to find out underlying malignancy. To find out underlying malignancy. So enlargement of lymph node, it is a sign. It is a sign of underlying disease. You have to search the cause for enlarged lymph node. You have to search for the cause of enlarged lymph node. whether the cause is in the adjacent area or the cause is distant. So cause can be infectious etiology and it can be secondary to underlying malignancy. Then one most common cause is autoimmune diseases like SLE, rheumatoid arthritis, then drug reaction, and granulomatous diseases means formation of granuloma like sarcoidosis. So these are the important causes of enlarged lymph nodes. But for us, practically important is infectious etiology and malignancy. Underlying malignancy and infectious etiology. Causes for cervical lymphadenopathy. Cervical lymphadenopathy is a common problem in children. Cervical lymph node red, tongue, ear, parotid gland, deep structures of neck, including larynx, thyroid, trachea. Inflammation or direct infection of this area causes subsequent engorgement and hyperplasia of the respective node group. Adenopathy is most common in cervical nodes in children in region related to infectious etiology. Lymphadenopathy posterior to the sphenomedonostoid is typically a more ominous finding with a high risk of serious underlying disease. Infectious etiology cervical adenopathy is a common feature of many viral infection. The classic manifestations of group A streptococcal pharyngitis is sore throat, fever, anterior cervical lymphadenopathy. Or typical mycobacteria also cause subacute cervical lymphadenitis. Then tuberculosis among chronic infection, very common cause for cervical lymphadenopathy. So lymph nodes in cervical area and their area of drainage is very important to understand. You should know the area of drainage of each group of lymph node. You should have the knowledge about area of drainage of each group of lymph node. Then only you can find out the cause for enlarged lymph node. But for that you should know the area of drainage for that group of lymph node. So important group of lymph nodes in cervical area. First, submental, which lie below chin. So its area of drainage is tip of tongue, middle part of lower lip, anterior gums, and anterior part of floor of mouth. So these are the area of drainage for submental group of lymph nodes. Then submandibular, they lie in submandibular triangle in relation to submandibular gland and facial artery. Afferent come from this area of drainage is the lateral part of lower lip, the central part of lower lip to submental, the lateral part of lower lip, upper lip, cheek, nasal vestibule, anterior part of nasal cavity, gums, teeth, soft palate, anterior fingers, anterior part of tongue, anterior two-thirds of the tongue that goes to submandibular and sublingual salivary glands. And if from go to deep group of cervical lymph nodes. So this is the area of drainage for submandibular group of lymph node. Area of drainage for submental. This is parotid group, post-auricular. Post-auricular lie behind the ear over the mastoid area. So the area of drainage is mainly from part of skull, posterior surface of pinna, and the spine of mastoid. For parotid, they lie in relation to parotid salivary gland and are yes. The afferent comes from skull, pinna, external auditory canal, face, and buccal mucosa. So the area of drainage, the afferents come from skull, pinna, external auditory canal, face, and buccal mucosa. Occipital group of lymph node, the area of drainage is from the skull. So submental, occipital, preauricular, postauricular, and submandibular, and their area of drainage. Now this is the lymphatic drainage of tongue. The tip of tongue to submental, anterior two-third to submandibular, posterior one-third of trunk drain bilaterally to jugulo-omohual. These are known as the lymph nodes of tongue. So this is the lymphatic drainage of tongue. Tip, anterior two-third, and posterior one-third. Cervical group of lymph node, as we discussed, divided into superficial group and deep. Superficial group lie over the sternocleidomastoid muscle, deep lying deep to the sternocleidomastoid muscles. Along the course of interjugular vein during the carotid sheath, they receive lymph from all the group, means from superficial group. The important group are jugulodigastric and jugulo-omohyoid. Jugulodigastric, which is located below and behind the angle of jaw and is mainly concerned with drainage of tonsil and tongue. Jugulo-omohyoid node, which is situated close to omohyoid muscle and is mainly associated with drainage of tongue. So, jugulodigastric, jugulo-omohyoid. Supraclavicular group of lymph node important always for underlying malignancy. These are important always for underlying malignancy. Whenever there are enlarged supraclavicular nodes, that means there is hidden malignancy in these areas. Hidden malignancy mainly from the thorax and abdomen, breast, lung, stomach, colon, ovary, and testes. So enlargement of supraclavicular group of lymph node always suggests underlying malignancy. Now, how to examine enlarged lymph node, how to check enlarged lymph node. So these are the methods to palpate lymph node or to palpate an enlarged lymph node or to check any enlargement of lymph node. So lymph nodes are always palpated with the pulp of three fingers, with the pulp of three fingers in rolling fashion with mild pressure. Pulp of three fingers in rolling fashion and mild pressure. You should stand either in front of the patient or behind the patient. The leg should be slightly flexed and then start examining lymph nodes with the pulp of three fingers one by one with gentle pressure and rolling fashion. So it is very comfortable to stand behind the patient and then stand from behind to front. One by one, you can palpate the lymph node. So first group comes occipital group, then come postauricular, then come preauricular, then come submandibular, then come submental, and then go below for cervical group of lymph node, superficial and deep, and then supraclavicular group of lymph node, like that. So you can go one by one if you stand behind the patient and neck of the patient slightly flex to relax the muscles. Then with the help of pulp of three fingers with rolling fashion and with mild pressure you can palpate the group of lymph node one by one. So these are the methods of palpating lymph nodes. So this is submental group, submandibular group, so this is the submandibular group, postauricular, preauricular, like that you can palpate one by one. So these are the pictures for enlarged lymph nodes. So this is the enlarged lymph node. This one is enlarged lymph node. This one is enlarged lymph node. This one is enlarged lymph node. So you have to palpate this enlarged lymph node. So this is also enlarged lymph node. These are the picture for enlarged lymph nodes. So lymphadenopathy or enlargement of lymph node can be localized, can be generalized. Generalized means if group of lymph nodes either two or more than two from non-contagious area, and localized means only one group of lymph node. So first, are there localizing symptoms or signs to suggest any infection, any neoplasm in a specific site? Second, you have to ask the patient about constitutional symptoms like fever, weight loss, fatigue, night sweat, etc. Means you have to rule out the various causes of lymph node and you have to ask the question according to that. If you are suspecting any infectious etiology, ask about fever, cough, etc. If you are suspecting underlying malignancy, ask about loss of appetite, weight loss, anything. So you have to search for the cause of enlarged lymph node and you have to ask the questions to the patient according to that to rule out the causes of lymph node, either infectious etiology or underlying malignancy or any drug intake or any drug intake. So which are the points to be noted while examining the enlarged lymph node? When you are palpating lymph nodes, which are the points to be noted? So first, size of lymph node. It is gross measurement 2 by 3, 4 by 6, 1 by 2 in centimeter, like that. So it is a gross measurement. So first your aim is gross measurement of size of the lymph node. Then consistency of lymph node. Three type of consistency: hard, firm, or soft. Soft and fluctuant consistency always seen in acute bacterial infection. Firm consistency usually seen in lymphoma or in viral infection or in tuberculosis. Firm consistency usually seen in viral infections, tuberculosis, and in lymphoma, particularly Hodgkin's lymphoma. And hard consistency usually suggestive of underlying malignancy.
55.
Usually suggestive of underlying malignancy. So consistency either soft, firm, or hard. So first point noted is size. Second point noted is consistency. Third point is tenderness. Whether they are tender or painless. Tenderness always suggests acute infectious etiology, and if they are non-tender, either suggest malignancy, autoimmune disease, or viral infection. If the lymph nodes are tender, always suggest of bacterial or acute infectious etiology, and painless in malignancy and in autoimmune disease. So, size, consistency, tenderness, then whether they are mobile or fixed. Whether they are mobile or fixed. Usually in malignancy, they are hard and fixed. In malignancy, they are hard and fixed. Whether they are mobile or fixed. Then matting. Whether they are matted or non-matted. Matted means more than two groups of lymph nodes connected with each other and they feel like a one unit. More than two groups of lymph nodes connected with each other and they feel like a unit. Matting means they come together. Multiple groups come together. That is called matting. So size, consistency, mobile or fixed, tenderness, and whether matted or non-matted. So these are the points to be noted while palpating lymph node. Consistency, whether it is stony hard, whether it is rubbery, whether it is soft fluctuant, or whether matting or non-matting. So matting is always a feature of tuberculosis. Matting is always a feature of tuberculosis. If the lymph nodes are matted, means multiple groups connected with each other, then it is mostly suggestive of tuberculosis or sarcoidosis. Mostly suggestive of tuberculosis or sarcoidosis. Then location of lymph node is very also important. As we discussed, supraclavicular group of lymph node always suggests underlying malignancy. A great risk of malignancy, particularly from mediastinum, lung, and esophagus. If they are left-sided, for right-sided supraclavicular, malignancy is in mediastinum, lung, and esophagus. If they are left-sided, malignancy from testes, ovaries, kidney, pancreas, from remote organs. Left-sided supraclavicular group of lymph node, also called as virtual group of lymph node, usually suggest malignancy in remote area like testes, ovaries, kidney, pancreas, stomach, gallbladder, and prostate. If para-umbilical, then abdominal and pelvic neoplasm. So location is also important to find out the cause. This is the size, approximate measurement in centimeter, tenderness, and location of lymph node. Generalized lymphadenopathy. The causes for generalized lymphadenopathy mostly primary malignancy like leukemia, lymphoma, then autoimmune diseases like SLE, rheumatoid arthritis, etc. In infectious etiology, brucellosis, cytomegalovirus, HIV virus, Epstein-Barr virus, rubella, tuberculosis, but the most is cytomegalovirus, HIV, and rubella and Epstein-Barr virus. These are the other for generalized lymphadenopathy. But most common lymphoma and leukemia. For Hodgkin, non-Hodgkin lymphoma and leukemia. These are the most two common causes for Generalized lymphadenopathy, Hodgkin non-Hodgkin lymphoma and leukemia. So which, how to evaluate the cause for lymphadenopathy? How to evaluate the cause for enlarged lymph node or lymphadenopathy? So important is history taking. Proper history taking. You have to ask the question, relevant questions to find out the cause for enlarged lymph node. So for that, constitutional symptoms like fever, night sweat, weight loss, anorexia, fatigue, etc. Then drug history, any travel history, occupational exposure, etc. This proper history taking is important. Then ask about any infection like URTI, pharyngitis, any insect bite, any periodontal disease, etc. So proper history taking to find out the cause for malignancy.